This will be a simulated run-through of a vital sign checkoff, with the exception of charting, as we do not have student access.
Knock, knock, knock. Hello, my name is Christina. I'm a student vocational nurse at Weatherford College. I'm here to take your vital signs. I'm providing privacy. Sorry, my curtain doesn't exactly close great. Hello, I'm gonna go ahead and wash my hands, phone in. Can I get you to verify your name and date of birth for me? Norma Washington, 12/4 of 38. Miss Washington, do you have any allergies that I need to be aware of? Darvocet? Great. We're not going to give you any of that today. Like I said, my name is Christina, and I'm coming in to do your morning set of vital signs. So I need to get your temperature, your pulse, your respirations, blood pressure, talk to you a little bit, see if you're having any pain. Do you have any questions for me? No? Fantastic. All right, Miss Norma, I'm going to go ahead and start by just putting the pulse ox on your finger, if that's all right. See if I can find your finger. Beautiful, ma'am. There you go. Let's go ahead and put that on there so that can start getting your oxygen saturation. Miss Norma, are you having any pain anywhere? No? Wonderful. All right, I'm going to go ahead and take your temperature. All righty. 98.6, fantastic. All right. Where's all my stuff? All right, here we go. So Ms. Norma, is it all right if I take your blood pressure on your right arm? Is there any indication why I could not take it there? No? Beautiful. All right, so first thing I'm going to do before I do this is I'm going to palpate for your brachial artery. Fantastic. All right, my dear, we're going to go ahead and raise this arm here so I can get this cuff on you. And with this cuff, I'm going to line it up with the artery mark for her arm, which is going to be towards the inner part of her body. Immediately, if I can get it attached, we'll be doing fantastic. All right, Ms. Norma. Up top here, see if we can get all these untangled. We want to keep them as untangled as possible. That way we can actually hear your true blood pressure, not me just jangling all these cords around. Stethoscope, ears facing inward. Check your diaphragm to make sure your stethoscope is on. We're going to come 2 finger breaths below where we palpated the brachial artery. Our diaphragm of the stethoscope is going to come here. We are going to hold, not using our thumb, where the diaphragm of the stethoscope is flat against the skin. Ms. Norma, I'm sorry, I forgot to ask you, do you know what your normal blood pressure is? Normally 130s over 80s? Okay, so with that, we're going to go about 20 above that, 20 to 30 as our starting parameter for Ms. Norma. Not so much with that one, are we? There we go. All right, Ms. Norma. Blood pressure is 128 over 84. Fantastic. We're going to go ahead and release this cuff from you, my dear. So we don't leave that on your arm. Hold this to the side for the moment. Next with Ms. Norma, I'm going to check our radial pulse. So look, using my watch here, we're going to find our starting point. We're going to count for 30 seconds. All right, 70 is my pulse. Oh, now next, just so you guys, because we don't know if you're going to have to do an apical pulse or radial pulse, you may get to do one or the other. We're going to do an apical pulse as well. All right, so apical pulse, we're going to listen to the apex of the heart. with that. So we're gonna do mid-clavicular, 5th intercostal space, which typically lines up below the nipple line. Before your check off, you do need to tell us where you're going to find that. So mid-clavicular, middle of your clavicle. So clavicle here to here, guys. The middle of that. 5th intercostal. So you're going to count down on ribs on the side to come to the mid-clavicular, and it's usually right underneath the breast tissue here. We're going to wear gloves for this because we are going to put the belt of the stethoscope underneath Miss Norma's gown. All right, Miss Norma. Be kind to your patients. Please try to warm up the belt of the stethoscope before you come touch them with this cold piece. Keep you covered, my dear. So mid-clavicular, 5th intercostal. Miss Norma doesn't have real ribs, so we're gonna follow down underneath, nipple line, and we're gonna count this for a full minute. Okay, 80. Beautiful. We're gonna tuck Miss Norma back underneath here, provide her some privacy. I'm gonna remove my gloves. I'm going to throw them away. Rewash my hands. I'm gonna check my pulse ox here. Miss Norma to get her oxygen level. Get her tucked back in. All right. I'm gonna go out and document these. Miss Norma, do you need anything at the moment? No? All right. I'm gonna give you your call light. The head of the bed, we can raise it or adjust however we need for her. We're gonna make sure that her side rails are up, that the bed is locked and in the lowest position. And then we're going to exit, foam out.